In this video, we are going to see the role and importance of insurance in healthcare and healthcare financing. Providing for healthcare takes away a good part of the income and resources of both families and at a country level. The advanced countries like USA, Japan, Germany, Australia, they are spending close to 10 to 17% of their GDP. That's the GDP is the annual income of the country. They are spending that towards healthcare. The Middle East countries, GCC, Saudi Arabia, UAE, Kuwait, are also equally spending 4 to 6% on healthcare, and compared to that, India's healthcare expenditure is less at 3%. The cost for medical procedures is far lesser in India compared to advanced countries, mainly because we have lower cost structure. The cost of setting up a hospital, operating it, the salaries to medical professionals, nurses, the cost of medicines, inputs, consumables, all these are lesser compared to advanced countries, and therefore India has got a more cost efficient healthcare delivery system. How much money is spent on healthcare is one aspect. The other aspect is who spends for the total expenditure on healthcare. That is the at a national level. That's the second aspect. If you see this chart, in the case of Dubai, 90% of the total expenditure is shared between government and insurance. Government spends 43% and insurance spends 47%. So the remaining burden on the households is only 10%. That is called OOP, out of pocket. So out of pocket is a very important figure, and the lesser it is, good for the citizens. So in Dubai, it's only 10%. So citizens are having less burden in the event of an emergency health situation. As this chart shows, over the last 5 6 years, the share of insurance in total health spending has been increasing from 35% to 43% in Dubai. This reduces the burden not only on the households, it also acts as a pillar of support for the government, because finally government expenditure also has to come from taxing the citizens. So, growth of insurance has proven to be beneficial in Dubai to achieve better healthcare. In this World Bank comparison between several emerging economies, India's out of pocket expenditure is substantially high at 50%. In this chart, we see that between uh, the year 2000 and 2019, India has been able to bring down out of pocket from 71% to 53%. But the progress recorded by a country like Taiwan is even more appreciable. They reduced it from 34% to 9%. Over the last 7 years, from 2014 till 2022, the government of India also has been able to bring down out of pocket expenditure from 62% to 39%. This has been done through increasing government expenditure, which has gone up from 29% of total health expenditure to 48%. So the central government has been stepping up its health budget, and this has reduced the out-of-pocket burden. But there's a limit to how much the government can do, because government's expenditure is rightfully reserved for providing support for the poor people. So government expenditure can reduce OOP for the lower income, the lower part of the Indian pyramid. But because of the nature of India, government expenditure will not be providing similar support for the middle class, the middle. That's why in the Niti Aayog, the planning commission, they came up with what the concept called missing middle. missing middle is the middle of the pyramid in India, the middle class, lower middle class to upper middle class. This group cannot be financed from government expenditure. The only available option is health insurance. So we need a better health insurance system that will provide universal coverage for India's missing middle. If you see Dubai over the last few years, Dubai has achieved 98% of the population, both the native citizen population as well as the immigrant population is covered from insurance. 98% is covered through insurance. This coverage has increased from 35% in 2014 to 98% right now. How they achieved it is by making health insurance compulsory for everybody. So by making health insurance compulsory, they have covered people in all walks of life. Maybe a carpenter or a driver, people in low income jobs to high levels are fully covered through insurance. And Dubai government saw merit in mandating compulsory health insurance because it spreads the risk of a unfortunate health event on everybody instead of it falling only on that family. In India, we don't have compulsory health insurance, but we what we have is called voluntary health insurance. Um, Even if there is no compulsion, Indian families are also recognizing that insurance is a better solution for achieving healthcare. And for this reason, if you see the chart, health insurance has gone from 20,000 crores of premium per annum in the year 2013, 2014. From there, it has gone to almost 1,20,000 crores in a space of 11 years. The space of 11 years, it's gone up 6 times. And the other notable fact is at that point, health insurance was only 60% of motor insurance. Now it has overtaken motor insurance and it is almost 20-30% more than motor insurance. So this is adequate proof that people are taking health insurance seriously, and it's set to emerge as the main pillar of healthcare financing in the future. Apart from health insurance, another pillar is life insurance. This is a less understood aspect. Life insurance also is it rests on the health of an individual. It rests on the morbidity and the mortality of an individual. The difference between health insurance and life insurance is health insurance is more suitable for low severity, high frequency health conditions. So those kind of medical expenditure are better covered under health insurance because these are year to year short term contracts. But things like what critical illnesses, critical illnesses like cancer or cardiac, these are um, high severity, low frequency health conditions, and these are better covered under life insurance. So ideally, the burden of covering healthcare should be distributed between health insurance and life insurance, and it's for that reason we should look at life insurance also in the pillar of healthcare financing. And as this chart shows, India's life insurance industry is also growing in a good way. Um, Maybe the rates are not as rapid as health insurances, but still it is good. And so in both the areas, India has got a long way to go, and that's when we will reach the ideal situation. If you look at the position across India, for 4.3% of the population has been covered through voluntary health insurance. Uh, if we exclude 40% are poor, That means the above poverty line people are 60%, and out of 60%, only 4.3 has been touched throughout India. But if you observe the chart, the affluent states, the like Delhi, Haryana, Maharashtra, Gujarat, and the southern states, Kerala, Tamil Nadu, Telangana, they are understood the importance of voluntary health insurance. So the coverage in richer advanced states in India is much higher compared to the all India average. A similar story for life insurance also. So this chart gives an idea that very soon, like Delhi, Haryana, India will be achieving higher health insurance penetration across India. Oh, east is east and west is west, and never the twain shall meet. This is a famous quote of Mark Twain, which most of us would have heard. Healthcare and insurance have just been that, two poles apart. But going forward, the answer lies in the second part of the same quote. The second part is something many of us may not have heard as much. It goes as follows: till earth and sky stand presently at God's great judgment seat, but there is neither east and nor west, border nor breed nor birth. When two strong men stand face to face, though they shall come from the ends of the earth. This part of the quote underscores the importance of integrating healthcare and insurance for the greater good of society. India's journey towards achieving a GDP target of $10 trillion by the year 2030 hinges in a big way on achieving universal health coverage. And for that purpose, the health insurance will be an important fulcrum. So, in this regard, we invite your support and collaboration to take this journey forward. Thank you.